NBC10 investigative reporter Mitch Blacher is keeping track of all of our region's vaccine logistics. Mitch, Moderna's vaccine could seriously be a game changer, right?
Yeah, Tracy, and that is really because there's more of it available. There's also a more important thing to think about. Moderna's vaccine, it doesn't have to be stored or shipped at ultra cold temperatures, making it a lot easier to get to and from where it needs to go than Pfizer's vaccine.
Pfizer's vaccine has already turned into shots in arms, but those in charge of Philadelphia's vaccination logistics say Moderna's vaccine could take beating COVID-19 to new heights.
The Moderna vaccine is going to be a lot easier for us to handle.
Dr. Carolyn Johnson chairs Philadelphia's Vaccine Advisory Committee. Pfizer's vaccine, in use right now, has to be shipped and then stored in ultra-cold conditions, around 94 degrees below zero. Once it's thawed, medical staff have to mix it with saline. Then they have 5 hours to administer it. Moderna's vaccine isn't as finicky. It can ship at normal medical temperatures around 4 degrees below zero. Moderna's vaccine can last up to 30 days in household refrigerators. It can stay at room temperature for up to 12 hours and doesn't need to be mixed with anything before use.
The less the handling of the product, the more stable it is at room temperature or even in a refrigerator for extended period. And low quantities of shipping make this a really ideal product to have in private doctor's offices.
Philadelphia health officials are also expecting to get more of Moderna's vaccine. Next week, about 10,000 doses of the Pfizer vaccine is scheduled to arrive in Philly. Once the FDA approves it, up to 20,000 doses of Moderna's vaccine are scheduled to ship here.
For right now, it's supply that is the issue, and it looks to be that the supply is going to be low for many weeks to come. At some point, supply is going to meet demand.
Dr. Johnson says best case, Philadelphia healthcare workers will all get vaccinated in the next month. Both Moderna's and Pfizer's vaccines require 2 shots to be fully effective. According to the FDA, they're each up to 95% effective when given as directed.
The providers and the hospitals are ready to give out as much vaccine as we can get into their hands. So the ability to administer vaccine is not the limitation here. It is the supply.
And another huge advantage of Moderna's vaccine is it is shipped in much smaller amounts. That's mainly because of the extremely cold temperature needs of Pfizer's vaccine. Pfizer's vaccine, it comes in about 1,000 package doses. Moderna's is just 100 doses at a time. That makes it much easier to divide up and send to individual clinics, pharmacies, or hospitals.